You're listening to the Place We Find Ourselves podcast, and this is the coronavirus episode. Let me tell you the main points for today, and then I'll explain each point in detail. For the sake of simplicity, I am omitting the sources for my assertions. Those of you who want to read the source data can find it on the episode page of my website. 3 main points. Number 1, the coronavirus is spreading exponentially, not linearly. This is a really big deal because our brains have been trained to think linearly, not exponentially. Number 2, as a result of the exponential spread, in the absence of aggressive action, the U.S. healthcare system will become overwhelmed, and this will affect everyone, even young, healthy people and children. I'll explain why. And number 3, the only way to stop really bad things from happening is to implement extreme social distancing measures immediately. In a future episode, I plan to talk more about how to care for our hearts and our bodies during this time, but right now there is a need to sound an alarm and wake people up. By way of introduction, let me say a word about fear. There are many social media posts out there urging us to keep calm and not to succumb to fear. You will notice that none of these posts are coming from epidemiologists or medical professionals. Is that because medical people are against keeping calm? Of course not. The difficulty with sentences like "don't panic" and "don't be ruled by fear" is that they are always true. You should never panic. The danger, however, is that these phrases can translate into a posture of closing your eyes to what is actually happening and closing your eyes to what is coming unless severe measures are put in place. So, whereas I would not want anyone to live in a state of dysregulation, a state of panic, I hope you feel some fear before this episode is over, because fear is a God-given response intended to wake us up to reality and mobilize us into action. Fear is a God-given emotion that is designed to mobilize our bodies into action in the face of threat. My concern is that many people are taking phrases like "don't panic" and "don't be ruled by fear," and they are letting those words allow them to avoid educating themselves about what's happening. Keep calm can lead to inaction when right now we need to be mobilized into action. The adrenaline that comes from fear is not a bad thing. God created that bodily response because adrenaline mobilizes our bodies into action. Exhortations like "keep calm" and "don't be ruled by fear" can easily lead to a lack of urgency and seriousness about what is at stake here, and a lot is at stake. Now, before I explain the major points, let me also say that no one knows what is going to happen. However, and this is a very important point, there is only one reason that we don't know what is going to happen, and it's because we do not know how people will respond. We do not know how seriously people will take this virus and to what degree Americans, at least, will respond by taking extreme social distancing measures. We don't know. We do know with absolute certainty what will happen if people do not take social distancing seriously. I'll explain what social distancing means in very concrete and practical terms in point 3. But right now, let me explain what we know with great certainty. We know exactly what this virus will do if we do not implement significant social distancing measures. And what will happen? It will spread, as it currently is, exponentially. So, first point, the virus that causes the illness called COVID-19 is spreading exponentially, not linearly. This is a very important point to get into your brain and into your body. What this means in terms of your subjective experience is that it will seem like the virus is just spreading gradually. You see numbers tick up in your region, but it doesn't seem like that big a deal. And then, bam! It will feel like the virus is everywhere. That's what the word exponential means in terms of regular daily subjective human experience. Our brains are more familiar with linear thinking than with exponential thinking. For most of us, exponents were a unit in math that lies buried in the recesses of our minds. As a result, the overwhelming majority of us do not have a felt sense in our bodies of what is going to happen. We do not have a felt sense in our bodies of exponential growth. Trying to understand intuitively an exponentially increasing growth in the number of infected people is not something that our brains have been primed to do. So, to get a felt sense in your body of what is going on, I'm going to invite you to do some math with me to help your brain remember how to think exponentially. Let's begin by assuming there are 10 infected people in your local area today, March 19th. Infections are doubling about every 3 days. So, to get the number of infected people in your locale on March 22nd, 3 days from now, we multiply 10 by 2 to get 20 people. Now, let's multiply 20 by 2 to get the number of infected people on March 25th. 3 days later, infections are doubling, so we multiply 20 by 2. It's 40 people. Now, if you do that 10 times, you will get the number of infected people in your city in mid-April. 30 days from today. That number is 10,240. Exponential growth means that in 30 days, 10 infected people will become 10,000 infected people. You have to understand that the spread of this coronavirus is not linear. It is exponential. In other words, if your community has 10 infected people right now, in 30 days, the middle of April, there will be 1,000 times the number of infected people in your city as there is today if your community does not immediately put significant social distancing into practice. So, think about this from the experience of day-to-day life. In March, it's no big deal. After all, by the end of March, there are only 160 people in my entire city that have the coronavirus. And you think, hey, I live in a city of 100,000 people, that's a pretty small percentage. But things start to heat up after the first week of April. On April 9th, there are over 1,000. And by April 18th, there are over 10,000. By April 21st, 3 days later, we double again to 20,000. 40,000 by April 24th, and by April 27th, 80,000 people have been infected. The nature of exponential math is that the number of infected people starts very slowly, and then the number of infected people absolutely skyrockets. This is why it's a big deal if you get coronavirus, even if you're young and healthy. You may recover just fine, but you are going to transmit it to other people. This is not a maybe. This is a certainty. How do I know that? Because diseases have an incubation period. The incubation period is the period of time between when you catch the virus and when you start having symptoms. The average incubation period for COVID-19 is 5 days. That means you will be interacting with other people for, on average, 5 days before you even know that you have the virus. Self-quarantining after you are diagnosed is not sufficient to stop exponential growth. That's way too late. Today, March 19th, there are currently over 10,000 known cases in the United States. Now, here's the tricky part. Because of the lag in testing in the United States, the number of known cases is a significant underestimation of the number of infections. So there are way more than 10,000 infected people in the U.S. today, March 19th, way more. Harvard estimates the actual cases as 50 times the known cases. So you have to understand there are way more infected people in your locale than what the statistics are showing, which means you are interacting with people that are infected and you don't know it. But even if we only had 10,000 cases in the U.S., since infections are doubling every 3 days, on March 31st, less than 2 weeks from now, there will be at least 150,000 known cases in the United States unless social behavior changes significantly. March 31, 150,000. What do you think will happen in the next 2 weeks, the first 2 weeks of April? That 150,000 will turn into 5 million by mid-April. Now, we're not going to see any of those numbers in the official CDC counts because we can't test this many people. So where will we see it? In the overwhelmed U.S. healthcare system. What do I mean by this? Well, the United States healthcare system runs smoothly when there are adequate supplies, beds, and workers. Supplies, beds, workers. The coronavirus pandemic is going to deplete all three of these: supplies, beds, and workers. Supplies. We're already seeing widespread reports from frontline medical professionals that they are running out of appropriate masks and face shields. Hospital gowns are being reused. This is a really big deal. But look, this is America. Surely we can quickly manufacture more medical supplies. Well, what if those medical supplies are manufactured in China? China's on lockdown, which means lots of goods are not being manufactured right now. This is the place we find ourselves. Beds, number 2. If we do nothing, going on with life as usual, and the virus continues spreading at its current rate, there will be 5 million infected people in mid-April. Approximately 20% of those cases will require hospitalization. That's 1 million people. There are only 1 million hospital beds in the United States. And 65% of those beds are already occupied by patients unrelated to the coronavirus. On March 15th, a physician from Australia named Adam Visser wrote a very important reminder about why this virus is going to affect everyone, whether you get it or not. And here's what he says. It's so well put. He says, look, if you're in your 70s and you get coronavirus, you've got a really good chance of survival if I've got a bed for you. If you're in your 60s and you have a heart attack, you've got a really good chance of survival if I've got a bed for you. If you're in your 50s and need bowel cancer surgery, you've got a really good chance of survival if I've got a bed for you. If you're in your 40s and have a bad car accident, you've got a really good chance of survival if I've got a bed for you. If you're in your 30s and have terrible preeclampsia as a complication of pregnancy, you've got a really good chance of survival if I've got a bed for you. But look, this is America. Surely we can just manufacture more beds and build more makeshift hospitals. We sure can. What we can't manufacture are more healthcare workers. There is a finite number of trained doctors and nurses in America. In addition, healthcare workers are at high risk for contracting the disease because they are caring for people with the disease and they don't have enough masks to prevent their exposure to the virus. This is where the objection, I'm young and healthy, if I get the virus, I'll be sick for a couple of weeks and then I'll be fine, no big deal. This is where that line of thinking is so dangerous right now. If you get the virus, you may have a mild case and not need hospitalization, but you will transmit the virus to other people who will transmit it to other people, and some of those people will need hospitalization. And if you're still thinking, okay, but that doesn't affect me, please hear this. An overwhelmed healthcare system affects everyone, even you and your family. Because what do you think is going to happen when your 11-year-old son breaks his arm in early May? He will be attended to by an orthopedic doctor that has been working 18-hour shifts for 7 days every week for 6 weeks because it was required to care for all the coronavirus patients at her hospital. Or the orthopedic surgeon will be sick with the virus and your son will be seen by a generalist in a tent in the hospital parking lot. What do you think is going to happen when your sibling's family gets in a car accident next month? They'll be rushed to a hospital, and instead of being seen immediately, they will be put in a triage queue where doctors are forced to prioritize patients based on success rate probabilities. This is currently happening in Italy. So please, Understand that even if you can recover from COVID-19, your mild infection has significant consequences for society at large as you infect other people without knowing it during the incubation period. And some of those people are going to need hospitalization, and that's going to overwhelm the U.S. healthcare system. And then, when you or a loved one needs medical care, it's not going to be available in the way you need it. Okay, point number 3. The only way to stop all of this from happening is with social distancing. Please hear the next sentence. Social distancing exists on a spectrum. Let's look at extreme social distancing, moderate social distancing, and lackadaisical social distancing. Many people in America right now are practicing what I call lackadaisical social distancing. It's the snow day mentality. It's like we're all off from school and work. No one's going into the office or going to school, but everyone is playing with each other in the backyard or at the park. This is disastrous because people think they are doing what they need to do to keep the healthcare system afloat, but they're not. Will this slow the spread of the virus? Of course it will, but not enough. Then there is moderate social distancing. Moderate social distancing is we're not going to restaurants with our friends, we're not doing play dates with our kids' friends, but when we walk down the street and we see our neighbors, we stop and chat with 1 to 2 feet of distance between us rather than 6 feet of distance. This is what's happening in my neighborhood. I ride my bike down the street and see a frisbee golf tournament going on. These people aren't huddled around a table talking, but they are 1 to 2 feet apart and talking to each other rather than 6 feet apart. Again, will this help slow the spread of the virus? Of course, but not enough. I went to the grocery store this morning and got there 5 minutes before it opened. There was a line of 20 people. Those 20 people were standing right next to each other and talking as if nothing was happening with the virus. People are not aware of what we're dealing with. Last, there is extreme social distancing. This is the only thing that will prevent the U.S. healthcare system from becoming overwhelmed. This is what I'm pleading with you to begin doing. What does it look like? 4 main things. Number 1, staying inside the 4 walls of your house as much as possible. This means no visiting other people, including extended family, unless they are in crisis, and going in person to help them is unavoidable. Number 2, you can leave your house to go to the grocery store, the pharmacy, the gas station, or to exercise. Number 3, when you leave your house, you must maintain a space bubble of 6 feet from every other person you encounter. That means 6 feet away from people in the store, 6 feet away from people when you're running or biking on the trail. And number 4, you wash your hands properly as soon as you return home from being out in public. I am not trying to whip you into a panic. I am calling you to action. I'm calling you to love your neighbor as yourself, which right now that means loving elderly people as yourself, loving those who have chronic disease as yourself, loving your healthcare staff as yourself. And the way to do that right now is by immediately practicing extreme, not moderate, extreme social distancing. You are not powerless in this situation. None of us are. Your power is to resist our usual social norms and encourage those around you to do the same. Conduct virtual play dates, virtual meetings, virtual happy hours with friends. Step back when a friendly neighbor breaches the 6-foot space bubble and explain why you're taking this potentially awkward action. If you feel spectacularly well and have no underlying disease, call your elderly neighbors and ask if they need anything from the grocery store that you can deliver to their doorstep. Have you seen the chart that compares the growth rate of coronavirus in different countries? It's a very important chart. Cases in Italy and Iran have exploded, and we're right behind them. But have you noticed the growth curve for Taiwan, Singapore, and Hong Kong? immediately, if you look at Hong Kong, what you will see is that Hong Kong doesn't look anything like the other countries. Why? Why? Because Hong Kong went through SARS in 2003. And so when Hong Kong got its 5th case of coronavirus, the government closed schools and citizens began extreme social distancing measures automatically. Why? Why did the people in Hong Kong naturally begin extreme forms of social distancing after just the 5th case? Because they went through SARS in 2003. They carry in their bodies a felt sense of the severity of a virus like this. The people in Hong Kong carry that knowledge in their bodies. So when 7 million people, that's the population of Hong Kong, when 7 million people automatically began extreme forms of social distancing, they weren't panicking. They weren't succumbing to fear. They were letting their fear do what fear is supposed to do: mobilize them to take significant action fast. My plea is that you will do the same. If you made it to the end of the episode, thank you for listening. I know it was a lot. More soon, hopefully. Again, I will try to post to my website on the episode page, on this episode's page, my sources and helpful articles and charts.